recorded. We do record these meetings. We record the meetings. We post them on our website pretty shortly after the meeting if people want to access them again. Uh, uh, and this is our agenda for today. I lost my whole train of thought, but that's okay. We always like to start with updates from providers who are working directly in the system. And you'll notice I put a little note on the reminder that I sent out just this morning that today I'm especially interested in hearing from providers who might have employment or career opportunities in their organization that they want to take a minute to share with this robust group of people that have joined us today. But always like to start with the shelter folks who are doing any transitional permanent housing programs, rental assistance providers, that kind of thing. Does anybody feel moved to share an announcement? And also feel free to raise your hand. That's probably the easiest way for me to see you. But I will keep an eye on the chat as well. Nobody has any announcements. Will you get another crack at it at the end of the meeting if you want to like warm up and then think about things that you might want to share with this group? Oh, Richard.
Yeah, I don't know if this is relevant, but I think the abuses that are happening in the shelter and the difficulties people are having getting sheltered because of dogs, because of metal detectors and all the other stuff, it's really relevant. A lot of people are not going into shelter despite the fact they could go in there because these restrictions are up. In fact, there was an article in the paper about a guy being manhandled by an individual recently.
Thank you, Richard, for starting off there. Gino.
Yeah, hi, Gino Tenor from the Work Preserve Program over at Significant Elements. I just want to give a quick update about for those of you who don't know, we have a youth training program. We work with youth 16 to 24, but also beyond that, that age, if appropriate. And we do a lot of building trades training, carpentry skills, and retail training. I just wanted to announce that we just got a significant grant from the Park Foundation to expand our impact. And part of that includes us being able to provide a stipend for our training, which is going to allow us to recruit people on our own. We typically work with the Learning Web and Workforce New York Job Link subsidized program for youth. So this is something that we're going to be rolling out in the next few months as we build our program. And again, our emphasis is really on it's kind of it's sustainability. So teaching and connecting people to potential green jobs and exposing people to introductory skills in carpentry and building trades. And that's kind of our real focus. And anyone is welcome to come and visit our workshop and come into our shop. And I'm as we get the ball rolling, I'll be hopefully trying to meet with people individually to talk about how we can collaborate and work together. A lot of what we're trying to do is also provide real assessments for and kind of evaluate people's skill level and kind of get them moved on to other programs out in the community or into jobs specifically. So I don't want to take up too much time, but I just wanted to put that out there, and people can contact me at Significant Elements if you want to talk more about it. But that's something I'm going to be going out more into the community and reaching out to potential partners out there. So thanks.
Thank you, Gino. Jeff Swan and then Jimmy Hardwick.
Good morning. My name is Jeff Swan. I'm from the Addiction Center of Broome County. Since it was brought up, that gentleman brought it up. That guy in that video is my client. And needless to say, he's very traumatized. He doesn't want to have anything to do with the shelter. And my concern is what's going to be done going forward to ensure that staff does not put their hands on the client. I'm just really concerned about that, and I just wanted to throw it out there that he's been relocated. He's very traumatized, and I'm just curious myself how this is going to be addressed. and what was going to be done to assure us that something like that doesn't happen. Thank you.
Thank you. I appreciate the nature of the conversation that's happening, but I do want to be clear that I'm not sure that this particular group of people are going to be able to address that with like integrity and full dignity to protect the client and the other people that are involved. Also, I haven't actually even seen if someone from SJCS is here with us today. So I hear that there's a significant interest in having that conversation, but I don't know that this is in fact, I know that this is probably not the place to have it. But we hear you. I hear you, and I'll see what we can do afterwards to arrange a more appropriate place to have that conversation. Thank you. Jimmy Hardwick.
Hey, Liddy, nice to see you. This is Jimmy Hardwick. Sorry, I'm in my car. Really happy to be here. Happy to see everyone. I just wanted to make a quick plug, because I'm not sure I'll be able to stay for the whole meeting, but my name is Jimmy Hardwick. I'm a professor and attorney at Cornell Law School, and we run a veterans clinic that is funded by the VA to address the unmet legal needs of local veterans experiencing homelessness or at risk of homelessness. I know I've connected with some people on this call, but I just wanted to, again, reach out and try to connect with the continuum of care here locally. So if you are working with anybody who is self-identifies as a veteran or has military status, meaning that maybe they don't identify as a veteran, actually those are the people we're trying to meet right now, who are falling outside of the traditional veteran support networks. So again, Jimmy Hardwick, I'll put my email in the chat if anybody wants to talk more afterwards. I can provide flyers. We do intake. I'd be happy to create any kind of referral partnership with people on this call. So thank you so much for hearing me out. Great to see you all. I hope you have a great day. Thanks.
Thank you. Jan Bridgeford Smith.
With you sent a lot of are you able to hear me?
Not really. I don't know if others are. I was just wondering if it was me. Breaking up.
Okay.
You want to try the chat?
Yeah, no, I think it's me.
Okay.
Yeah, I'll just put this, I'll put what I was going to say. That'll be fine. Thanks.
Okay, great. Thank you. So I don't see any other hands. There is another crack at announcements at the end. But I'm excited that Rashika Hall is here with us today. And Rashika Hall is one of our HUD field office representatives, and she's here to say hello and maybe hear from us a little bit about some stuff and introduce a new colleague. So take it away, Rashika.
Thanks, Liddy. I appreciate that. Great to be here with you all. And wow, you're vast in numbers. We have 6 grants in 510. So I often kind of think about you all as small, but you're not. You have a lot of representation here and involvement, and I'm so happy to see that. That's wonderful. With some COCs have problems getting people to a meeting, but not you all. So that's great. Thank you. My name is Rashika Hall. I am your senior CPD rep, and I am located in Buffalo. I wanted to get on, and I tried to get on at least in the beginning of the year, hear from you all. But I definitely wanted to get on to introduce you to our newest member of the team who has been assigned to 510. His name is Don Dauman, and he is here on the call. I'm not sure if he wants to introduce himself, but I wanted to make sure that we have faces with names. I'm going to put our information in the chat. Don, did you want to say hello?
Sure. Thank you for having me, folks. I'm very happy to be here. New to HUD, but not new to housing. My whole career of 33 years has been in some form of housing every day of my career, either in program management or fiscal administration. So I'm thrilled to be here and learn a lot more about your COC, and hopefully I help you along the way as I support Rashika and her work with you.
Thanks,
for
Don.
having me.
Yes. And Liddy gave me like 15 minutes. So this is great. I want to
Yeah.
hear from you all. And I'll just kind of be a fly on the wall as well. I've already heard some interesting things and announcements. But I did want to take the time to kind of touch on a few things just to give you all a heads up that we are starting monitoring season. So there will be some monitoring trainings that'll come out. I try to involve everyone through communication. We have a listserv. If you're not getting any of my emails, if you've never received an email from me ever, please put it in the chat and I will add you to that listserv if you're interested in receiving just updates, information from HUD that directly comes from out of the field office, and I'll make sure you're added to that. But again, we are starting the season. It starts in pretty much March. It goes to September. There will be some training that's advertised, but I wanted to let you all know that as we approach it, our office kind of comes from the perspective of partnership. We're here to help. It is not a gotcha, as is often said. We are really there to see all the great work. I love looking at best practices and things that can be taken from your area, maybe duplicated somewhere else. I think I saw Anissa on the call. I've used the city of Ithaca many times and the grants that they receive from HUD as an example of how things can be done. And so we're there for that. I want to see and kind of brag on you all a little bit. Also provide some technical assistance where needed. And I want to give you an idea of risk. So if this year you are, you receive a notification letter and you are going to be monitored this year, don't think you just drew out of a hat type of thing. There is a system to it. And it also doesn't mean that you've done something wrong or anything like that. It could be that you've never been monitored. We have some grantees that have never been monitored. Some may have a larger grant, and just by the sheer amount that you receive from us, you're going to be monitored. Or you might have had some turnover in key positions, and so you're monitored. So I just don't want that to have a negative vibe or to cause stress levels to rise. We're partners and we can't do this work without you. Some tips. I'm just going to go through some things that I see has become common as far as findings as we go through. And one of the big ones is lead. I've gone through many agencies and they are checking off lead off of the inspection checklist, but they don't really know what to look for. They've never gone through the training. There is a visual lead training. You probably get done with it in 10 minutes. It is not a heavy lift at all. Take that training. If you need the link, I will make sure that you all have it or get it to Liddy or put it in a listserv and make sure that you have it so that you and your staff can go through that, get their certificate, and know how to properly visually assess lead. And that is handled properly, that there is an attestation from either the landlord, from the participant, or both, signing off that they received that brochure that you would give everyone protecting people from lead. So just make sure that you're doing that. Another common find is internal financial audits are not done. So every agency at some point should be on a schedule to do an internal financial audit of themselves. So this is not the third-party audit that you might be thinking of. This is something that your CFO will go over, something that however you're classified, the director of finance will kind of say, okay, we're gonna have an internal audit, just make sure that our system is working properly, making sure there's no duplicate payments, making sure that all of our T's are crossed and I's dotted. And that is recorded, and it could be official, unofficial, as long as there's documentation of that. And so make sure you're doing that. Incomplete policies and procedures I see all the time. Just make sure that they're updated and accurate. And I know things change often. So it should, any policies and procedures, SOPs should be breathing and living. So this is not something that is going to stick to it. And, you know, you have to go through, well, of course you're going to stick to it, but I want you to be aware that they should often be updated, and everyone acknowledge that update, not just put it in a policies and procedures for that person that may be keeping them updated and then not convey that to the rest of the staff. So as they're updated, maybe include that in your internal staff meetings so that everyone is aware of the updated policy and procedure and that all your written standards are updated. Inadequate homeless verification. Now, this one is a doozy because it often comes with a repayment of funds. And that is the last thing that HUD wants, especially with these grants serving very vulnerable populations. We want to make sure that it's done accurately. But if you charge to the grant for something or someone that was ineligible, you can't do that. You're out of compliance, and whatever funds that were placed to that line would have to be repaid from non-federal funds. And so we want to avoid that. The biggest thing that I see is just the documentation isn't there. So please make sure that you're getting adequate homeless verification. Of course, we like to start with, you know, the third party letter or some verification from DSS or some type of paperwork from an entity, even the shelter that they came from, all the way down to self-certification, but something must be in the file. So make sure that you're doing that every time, not just some of the time, every time. Match verification and tracking, make sure that you're doing that when you're awarded that you have match, and you're giving kind of a forecast of what match will look like, but then tracking it throughout the year so that what you said you're going to use as match and what you actually used as match, that it lines up and that you're tracking throughout the year. Personally identifiable information. I was so happy that Liddy kind of said this probably isn't the venue to answer some of the abuse conversations to protect the client and the agency, those types of things, making sure we're always cognizant of keeping our participants' identities and their information safe. That's highly important. So make sure that you have a procedure in place and you are doing that consistently across the board. Accurate, current, complete documentation. And something else I see that gets finding is untimely reporting. So annual performance reports that are due at the end of the performance year, making sure that they're submitted on a timely basis. I feel like I may be approaching my 15, but there are some updates for VAWA requirements for COC. So there were some updates that went in effect October 1st of 2022. And we just want to make sure that if you have not made yourself aware of that you are, I could put the memo where you can see that and read through it. It's not that long. I think it's like 8 pages, where you can update your policies in regards to the Violence Against Women Act and how that's incorporated in your programming. There's some revisions to the definition of domestic violence. It includes economic abuse as well as technological abuse. So that was, you know, some of the key changes, but I'll put a link in the chat to that memo. Lastly, COVID waivers have expired. I think we're all aware of that. So if you weren't getting disability documentation for a PSH client, if you were have a leasing program and you weren't doing FMR, you were doing rent reasonable, which may have been much higher during COVID, but you weren't doing FMR and had a waiver for that. Monthly case management, you may have had a waiver for that. Not doing inspections may have had a waiver for that. Or even the 1-year lease requirement, you may have had a waiver. All the waivers have since expired, and so we should be doing inspections and making sure we have the 1-year lease, and, you know, making sure we have strong, unique to that particular participant, monthly case management, that you are getting the disability documentation and all of those types of things. Lastly, I want to always remind you about self-care. I've been in housing almost 20 years. I started in a faith-based nonprofit HUD counseling agency, managing things there. And one thing I knew is that burnout is real. We do a lot. You all do a lot. It's a passion work, and sometimes it can be very draining. And so it's very important that you take care of yourself. And so anytime I'm with you all, I just want to remind you of self-care. For some of you, it might be actually taking your vacation time, even if it's the town over, or even taking a lunch. Some of you don't even take your lunch. Please, step away and do that. It's so very important. So that's all I have, Liddy. I think I'm
Thanks,
right at time.
Rashika.
You're welcome.
Lovely. There was a deep dive into the inner workings of HUD things. Thank you. It was useful and a great reminder about self-care. Next this morning, I am happy to welcome Sue Ellen Holmes. She's joining us from Vicino Group to talk about the Asteri project that has a lottery open right now for applications. Are you ready, Sue Ellen? I don't actually see you.
I am here. I'm
Oh,
very
there you
sorry
are.
that
Hello.
you can't see me, but I am sitting in a car doing this, so that's why.
Well, thank you for coming to do it.
Of course. For 32 years, I've been in affordable housing, and I have to say this one is the most exciting. 181 units, $150 million project right down next to the mayor's office. It's got a skytop deck and a lounge area, full kitchen for folks, community areas. And to top it all off, we get to work with TCA again. So what could be better? We're very excited about this one. The income ranges for the folks who will be in supportive housing will be the 30 to 40% AMI range. And then we also have 50, 60, and 80% AMI for everyone else. Very affordable rents when you look at the broad scope of what's available in the Ithaca area. And, I would just say that every project that we work with, it appears that, 98% of the people that we end up housing are directly from the immediate locale. So I expect that most folks will be from the Ithaca area. And we're very excited. And it wouldn't go so well if we didn't have such an amazing partner on the supportive housing side with TCA. We're very excited about that. And the CFC, there's grant monies coming to assist in a specialist who will help with folks moving in that are outside of the ESHI or the set aside population who still may need help getting acclimated and moving in. If there's anything specific that you have a question about, I would just say that we are accepting applications through the 19th of this month, so coming up quickly, for the lottery itself. And then thereafter, we expect to still be accepting applications. The lottery itself will be held online on the last day of the month. And what I'm typically used to seeing is, unlike other locations like New York City, where you end up getting thousands of applications, the lottery, we don't normally get that. We get a small handful of applications for the lottery. And then once it's more known exactly when the building will be opening, we tend to get flooded with applications at that point. So right now we have just over 20 applications, and that's not shocking to me. I expect that once we can announce an exact date for opening, then we'll have more folks interested. The website is up. It's asteriithaca.com. So it's ASTERI Ithaca.com. And all the information, the application, the income limits, the rents, everything is on that website. And as far as accepting applications, we're accepting them via mail, via email. Very soon, within the next week or two, we will be able to have people actually apply online if they'd like to. And until we actually hire for that building, we have the folks in a different location assisting. So they're sending them to Cherry Street at this point. Does anyone have any questions about the property?
Go ahead, Teresa, but you're muted.
Yes. I was interested that you are so excited about working with Tompkins Community Action, because I had heard I think fairly directly, that there was a big problem at Art House because TCA was unable to really keep it staffed.
Well, I will say to you that whatever you may have heard about that, that has been worked out. So that's not our current experience at Ithaca Art House. You know, Ithaca Art House, without passing the buck, has a lot of unique challenges that have to do with the immediate surroundings of the building and not necessarily the people living within the building. And you know, we've tried many things to assist there. We have a great new crew in there cleaning 5 days a week from the outside, third party. We brought security in very early, police officers who had concealed weapons that stood by the doors, anything we could do to try to make people feel comfortable. And I can't pass the buck to TCA. It's just an overwhelmingly challenging property. I would just say that. And I think if you just take a drive down by, I'm sure you're familiar with the area, by Ithaca Art House, you might understand why we have some additional challenges that come from outside the building itself. When it comes to working with TCA at this property, the office, the way it's set up on the 4th floor of the building, we've got more folks who are going to be in there. There's 4 different offices as opposed to 2 folks at Ithaca Art House. It is a slightly larger property, 181 units. And Danielle and her group are very responsive. During COVID, I couldn't just say it's TCA. I would say it was probably everyone. I'm sure you experienced issues with staffing and keeping people, but we don't seem to have that issue anymore. And I don't see that issue with TCA. The same 2 folks who've been working, since I've been involved with Vecino are still there in the building. So we are very excited to work with TCA.
Thanks. Sounds like another follow-up meeting is in order. Does anybody else have any questions about the Asteri affordable housing project on Green Street specifically? Martha.
Yeah, this is exciting. What's the expected opening or, time when people can start moving in? Roughly.
Yep. So what I'm hearing right now is that we can anticipate moving folks in mid-month, so around the 15th. The building may be done as quickly as May 1st, but of course, not only do we have to get approvals from folks at the local level at code enforcement, but then the state as well. So there's just a little cushion built in. But I can assure you, the moment that my development team hands me a key, we can move people in that same day.
Did you say mid this month?
Mid-May.
Mid-May. Oh, okay.
Mid-May.
Okay. Thank you.
And towards the end of the month, if there's folks moving in, we know we have to be very cognizant of all that goes on in Ithaca at the end of May with the different colleges. And there's 2 different ones that have, commencements. So that's all on my radar. And I'm going to literally not have anyone move in on those days. I will work around that. So it's before or after.
Thank you. Annie. You are muted if you are speaking.
There we go. Hi, my question is with regard to parking. Is there any plan or intention to have spaces where people can park?
Yep. The logistics of that are something I'm not quite familiar with yet. I have an upcoming meeting next month to learn more. But my understanding is that within the parking garage, there is some parking set aside for our residents of the building and perhaps visitors. But like I said, the logistics, I wouldn't want to speak on that because I haven't had that meeting yet. That'll be in March. But I can provide that on another meeting when that comes up. And also, when things get further ahead, I'd be happy to invite all of you to come and take a look, of course, at the building.
Thank you.
Thank you.
Sure. I probably went way too quickly and spoke way too fast. I don't know how much time you allotted for me. I'm so sorry about that.
That's okay. We put some links in the chat. We can put the application and the links and the website links and stuff. And if people have questions afterwards or want to follow up, I can send out follow-up information to folks. You know what I missed actually is the unit sizes.
Oh, okay, sure. Let me just pull that up. I want to make sure I
Sorry.
give you all the information. Okay, so we have studios 1s, 2s, and 3s.
Great. Thank you.
Yep.
That is useful. All right.
And the rent ranges start as low as the $735 range. And then the very highest rent is, oh, that's the gross rent, actually. Hold on one second. Yep, $735, and the highest rent is $1,527 for an 80% 3-bedroom unit. So very good rents.
Oh, I know you're in your car, so I don't know if you can see the chat. A question came into the chat about the square footage per unit. It's a very specific
Okay.
question.
Let me just take a look. I might be able to provide that.
Okay.
So the smallest unit I see is 470, and the largest unit I see is 1050 as far as square feet.
Great. Thank you. Those are probably some of the most affordable units I've heard coming online in our area in a long time.
Yep, and I can be more specific. I just pulled it up. So the smallest unit at 470 is a studio, 1 bedrooms, 621, 2 bedrooms, 779, 3 bedrooms, 1050. Those are the square footages.
Great. Thank you. Thanks for joining us and sharing that information. I hope people will think about these units as an opportunity, not just for people that we're serving, but also for like us and our colleagues and our friends and loved ones who are all sort of struggling to find affordable housing and may be well within those income requirements. And there are many benefits to living downtown. So I hope that was useful for folks. Next on the agenda today, we are graced by the presence of Human Service Coalition's very own Alex Moore to talk to us about some very cool, collaborative, transformative work that we're working on in partnership with some folks. Alex, are you here and ready to rock?
Here and also ready to rock.
All yours. Rock on.
All right, beautiful. Thank you for that introduction, Liddy. I'm gonna share my screen. I put together just a short deck. I'm a pretty visual person, so I find that that's helpful. So if you all could just let me know if you see my screen. Okay, I see some head nods. Beautiful.
Yeah.
All right. Good morning, everyone. My name is Alex Moore. I am the Community Integration Manager here at HSC. And I'm so happy to be here today to talk with you all about this community health network. I know we've got a few folks on the call who are already participating in the network. They've already heard my spiel, so apologies to you all. This will be about the same information that you've heard already. Maybe some new bits thrown in there. We'll go ahead and get started. All right, so the Community Health Network is a grant-funded partnership between the Human Services Coalition and Cayuga Health. This grant was awarded by New York State as part of the Healthcare Facility Transformation Funding, if any of you all are familiar with that pool of money. And the intention in developing this network is to really strengthen the connection between healthcare and social care providers in the area. So we want to do this by streamlining the way that we send and receive referrals and exchange essential service information and really communicate across organizations with the ultimate goal of improving the quality of services and better supporting our clients. So this includes bi-directional referrals, which to me is the really exciting part. So this will be a referral platform that supports referrals from healthcare providers to community-based organizations, from community-based organizations back to healthcare providers, as well as between community-based organizations. And we'll dive a little bit more into kind of the logistics of that. But before we do that, I do want to share some kind of common terminology that I might be referencing throughout the presentation. We all come, of course, from different backgrounds, different experiences, and have different levels of familiarity with this content. And these may mean something different to different folks. So I just put a few kind of acronyms, terminology on the screen here, so you can take a look at that. And then just a note that I might be using patients and clients interchangeably, just depending on kind of where the care is taking place, if it's in a provider's office or if it's in maybe a community-based organization. But just know these are the same people that we're referring to here. And please feel free to stop me at any time. I'll try to keep an eye on the chat, but also feel free to just take yourself off mute and ask any questions that you have. Okay, so here you can see we've got an overview of some common perceptions of social needs from both the providers and the patients' perspectives. In this first box, we've got the providers who understand that there are unmet social needs that have to be addressed as part of a holistic, real person-centered plan. And they want to connect their patients to resources and local CBOs, but they don't have a systematic referral system. So there's no real good way to do this right now. And then patients here in the middle box feel that providers are actually not aware of their needs outside of the medical setting, outside of a diagnosis. And they'd like to have additional conversations around other options for support and community resources. So you can see we've got a common goal here, but there's really no effective way to facilitate this transfer of information. So what we'll talk about a little bit today is how we can standardize our approach to addressing these needs across the board. And then zooming out a little bit from our local community, we are not the only ones who recognize that there are gaps in our current system. We really want to take advantage of similar work that has been done by other organizations, so we're not reinventing the wheel here. Zooming, I guess, out even further, back to the passage of the ACA, that kind of led to a renewed focus on some of these factors that influence patients beyond the clinical settings, and really recognizes the enormous impact of these complex social circumstances. So that includes housing instability, food insecurity, inconsistent income, as you all know. And then, we know that these elements play a significant role in shaping these patients' health trajectories alongside the medical care they receive. So we cannot look at one without looking at the other. And really throughout the past decade and a half, really since the passage of the ACA, there have been a lot of governmental and nonprofit organizations that have kind of emerged to meet the challenges here and coordinating health and social care. And as this landscape evolves, this concept of community information exchange, it's still pretty new, but we can learn from previous approaches as we build kind of our own understanding of what this is going to look like in our own community. So some lessons learned from examining the prior work. Number one, as I mentioned, there's few precedents. This is still a new concept. We don't have decades of past history on which to base our framework, so we are learning as we go. Number two, technology is not a singular solution. We are not here to replace humans. Effective CIE implementation really needs to build trust, build capacity, which requires pretty significant investments in governance, process, change management, and organizational resources. And we also want to recognize and acknowledge that organizations may already have existing databases and mechanisms for exchanging information that conflict with new systems that might be implemented. So we want to make sure that we're taking that into account as we're kind of building and developing the system. We don't want to erect any new barriers to care or create any new work for individuals who are involved in exchanging this information. Number three, more data doesn't mean better outcomes. We also require, the work requires trust and transparency. And we know too that there's real value in community ownership of these data ecosystems, meaning that individuals can own their own data and it doesn't belong to a singular entity. So those are all big questions that we'll be addressing as well. And then finally, closed loop referrals are not the only use case for community information exchange. We know that this can be really valuable in care planning, coordination, and benefits assistance across organizations. And then perhaps kind of even more relevant to these examples is a local collaborative screening and referral pilot that was launched by Cayuga Medical Center in 2021. And that screened patients annually for unmet social needs. So you may be familiar with this screening tool that we have here on the right if your primary care provider participated in this pilot. It included 7 primary care practices and 2 CBOs, HSC and Cornell Cooperative Extension being those 2 CBOs. Here we have an interdisciplinary team, that led the co-design referral and referral workflow. And then in 2022, the pilot was expanded to enable that direct referral to CPOs. And I mentioned this because this work has laid a really important foundation for this project, which is going to build upon the existing successes of that pilot and expand the directionality and scope really of the referrals. I'm going to pause here, see a couple of things in the chat. Those are direct messages, so I'm going to keep going. Okay. All right, so I've laid out here kind of 3 core requirements for our system. 1, we need the capability for data exchange. That's kind of the foundation of the project. Organizations need to be able to effectively transfer the right information at the right time to the right organization. We need to create or integrate an existing resource directory so that those who are referring, those who are making the referrals, have the most up-to-date information about participating organizations and the services that they offer. We've heard from a lot of organizations that while Tompkins County and the surrounding area is quite resource rich, we don't really have a good way of communicating that information between community-based organizations and more broadly. So we know maybe by warm handoff what other organizations do, but we really don't have this kind of holistic picture of what every organization in the area is able to do. And then finally, we need to be able to aggregate the data so that we can understand gaps in care and then define success metrics for ourselves. So figure out how we're doing and how we can improve. Okay, so we have recruited 15 CBOs from a variety of social service sectors to help us design this network. We looked for organizations with an expertise in a priority health-related social service area, which is kind of this these categories that you see here. We also wanted organizations that are leaders in the county, who have trust with partners and other community members, and then of course organizations whose organizational leadership is willing to commit the time and the resources to participating in this program. I don't think I mentioned it, but this is a 5-year program, and the commitment of the first cohort is 1 full year. So it's no small task, and we're very, very grateful for those organizations who've decided to join our first cohort. And then here you can see kind of the structure of the project and the timeline. And I think I'm over time, so I'm going to speed through this. But we've divided cohort 1 into 2 working groups that meet biweekly. So we've got a network governance working group, which will handle data governance, privacy, confidentiality, all those big, beefy questions. And then the engagement and communication group, which will support the participation in the network, of providers, of community-based organizations, of staff, of CBOs, making sure that people are receiving the right information at the right time. And then we've also have two community advisory boards, one with members with lived experience, which I'll talk a little bit more about in a second, and then members from local organizations who might not be involved in cohort one as a participant, but do want to stay close to the project and want to be able to advise on progress. And then the bottom here, you can see our timeline. We are in phase 1A of cohort one. We anticipate this running through April-ish. Of course, this is a new project, so this will kind of depend on what the network decides to create and develop. This could go a little bit longer than we anticipate. And then we'll move into technical and operational development, so kind of a testing phase. And then phase 2, which we're aiming for beginning of 2025, we will be looking for a cohort 2. So we'll be looking for more organizations to participate in the network and expand the reach. And then finally, in 2028, we anticipate an open invitation. So anyone who would like to join the network will be able to do so at that time. And my last plug here is for Community Advisory Board members. So we are looking for individuals who are high utilizers in the system or have attempted kind of multiple interactions with different types of care. We left this really broad because we want to be able to include a wide range of folks. We have, again, a pretty broad commitment here. So we will have board meetings. We can do one-on-one interactions. We can do small focus groups, really whatever works with people's schedules and whatever their engagement preferences. And then we will be offering $25 per hour for compensation. So I have a QR code here. If anybody is interested, please feel free to fill out that form that I have linked, and I can share that in the chat as well. Shoot me an email. I'll put my email in the chat, and would love to get some folks involved here. We are just starting on the community advisory board, so this will be brand new and lots of exciting opportunities. Okay, I think that's all I have. I'll stop sharing. Oops, sorry, lights went off.
Thank you, Alex. Good light measures there. Do people have questions? It's a lot of information. It's cool and innovative. Questions at all for Alex?
The contact information in the chat here as well. Always happy to talk more about it if folks have questions.
Yeah.
I wasn't able to grab the QR code if we can get that information in the chat as well.
Yeah, absolutely. I will pop that in there.
We will put the PowerPoint. We try to post materials with the recordings on the Homeless and Housing Task Force section of our website. So you'll get a second crack at the PowerPoint. I am a PowerPoint reviewer. I go back and look at them. Yeah, it's a lot. Great. So that concludes our agenda. We here at the Continuum of Care have a couple sort of brief announcements or things that we want to talk about for like regular Continuum of Care stuff, membership stuff, or future membership stuff. But I wanted to see if anybody wanted to take another crack at any announcements about jobs or other things in their organizations before COC did a couple announcements.
Actually, yes, I would like to say that for Asteri Ithaca, we will be looking for 2 maintenance techs, a cleaner, an assistant manager, and a manager. And the manager would have to have housing experience, particularly tax credit. We would, of course, hope that the maintenance folks had maintenance or cleaning experience, but we will be posting jobs, not quite yet, a little bit closer to April 1st.
Thanks. Mary.
Good morning, everyone. Mary Helen Beavis. I'm the new Workforce Program Manager at Ithaca Area Economic Development. I've been in this role for just about a month, so getting my feet wet. But my main role is overseeing our Direct to Work program, which is a career pathway initiative to prepare un- and underemployed individuals for entry positions within manufacturing. So the program is a full-time 4-week training program that's designed to operate just like a first shift job. And we are currently recruiting for our first cohort of the year. A lot of information I could share, but just overarching, folks who go through the program, they'll receive a $500 stipend, opportunity to get a certified manufacturing associate certificate, and there's a guaranteed interview with one of our participating 8 employers. We did recently receive a $1.2 million grant, so we do have additional resources to assist with any sort of barriers that folks might have, such as assisting with transportation or childcare costs. We also partner with Law New York to ensure folks who are participating in the program understand what is on their background and feel empowered when transitioning into an interview and just setting them up for success. So I'd love to connect with any community partners who may be working with folks who may be a good fit for our program. We do ask anyone interested to attend an info session, which I already have some dates set. So if anyone's interested, feel free to give me a shout and I'll put my email in the chat. Thank you.
Thanks, Mary. Lee.
Hi, everyone. I'm Lee. I'm at Cooperative Extension, CCE Tompkins, and I haven't been to one of these meetings before, so just wanted to share why I'm here and the services that relates to the Homeless and Housing Task Force. We have free energy advising through Cooperative Extension, and we focus on helping low to moderate income folks connect to grants for weatherizing their home and getting more efficient heating systems. So if anyone you work with could use weatherization to make their home less drafty, save money on heating, or needs a new heating system, you're welcome to connect them with us. We also run workforce development programs to help folks gain footing and training to enter the clean energy workforce. We have on-the-job weatherization training going on right now where folks are learning how to insulate rim joists in the basement. And we also have classroom-based environmental literacy courses. So, and internally, or I shouldn't say internally, but our team itself is expanding. We're hiring for folks to do the energy advising work that I do. So, variety of offerings there, and glad to join today. Thanks, everyone.
Thank you. Anissa.
Hi, everyone. I know you've been seeing my post to the listserv about the action planning process for HUD funds that come to the city of Ithaca that are used for affordable housing or community development. I know this process can feel kind of confusing, so I want to just underline to people, you can feel free to reach out to me if you want to just ask questions away from this group. But I wanted to give some simple updates. So the application process is now done. We received 22 on-time applications for uses of these funds. And what happens next is they go to our the Ithaca Urban Renewal Agency's committees and then board to recommend to Common Council projects to fund. I want to point this out because there's various opportunities for public comment during this process. The schedule is on our website. You can reach out to me to ask me about the schedule, but you all here might have feelings or thoughts about projects that you want to support or that that there's a need for or something like that. You can engage in the public comment process, and you can comment on any community needs that you observe in the city of Ithaca if you want to have that part of our public record so that we can consider that as we're looking at priorities. It can go into our 5-year strategy. So I just want to point out that there's various ways to engage in the action planning process. One is to apply for funds, but even if you're not applying for funds, you can comment on things that you observe, or if you want to support any of the projects that you see coming forward. So reach out to me if you have any questions about that.
Thank you. Anissa. Great. So we have a little time until the end of our meeting. And so we did want to share just a little bit of information about what the continuum of care is up to for 2024, and specifically about some of the committees that we're working on for this upcoming year. So like I said at the beginning of the meeting, this is the Homeless and Housing Task Force, which is the public, open education and outreach part of the COC for folks that are interested, invested in taking that deeper dive, becoming a COC membership agency and potentially joining a committee. There's a lot of opportunity within the continuum of care to both learn about stuff, but also do stuff to try to work within the system to be part of the system we envision, which is in which homelessness is rare, brief, and one time. So we are going to tell you just a little bit about some of what the continuum of care is planning to do in 2024 or work on. I don't promise to do it all in 2024, but this is what we're working on in 2024. If Simone is ready to go, I will give it to them.
I am ready to go. Hi, everyone. If you do not know who I am, my name is Simone Gatson. I use they, them pronouns, and I work for the Continuum of Care as staff, but also as the coordinated entry lead for the county. And so we just got our committees approved by our governance committee yesterday. So you'll see I've put a couple of flyers in the chat about those committees and work groups, and I've basically taken some of that content and put it on some slides just to make it a little bit friendlier to this setting. But you can see all the information I'm about to share on what I put in the chat. I've also put a link to our form if you want to sign your agency up to be a COC member moving forward. The COC has over 20 member agencies, and we want to keep growing and keep making sure that we're including all of the stakeholders that will help us to achieve that goal of ending homelessness in Tompkins County. So we are asking that even if you are already a COC member to fill out that form so that we have all the information we need to include you on things moving forward. And if you're not, then consider signing up. All right, I'm going to share my slides really quick. And I'm just going to give a brief overview of these committees. So you'll hear me talk about committees, and you'll hear me talk about work groups. So committees are ongoing and discussion based, and work groups are a little bit more project focused and time limited. We got feedback from folks who were in our committees last year, and so we're trying to make sure that all of our committees are have a very specific goal and have a very specific kind of scope and structure. So that's what we're looking forward to this year. In terms of 2024 COC committees, so the first one is that I'm going to discuss today is our Unsheltered Homelessness Committee. And this is going to be an educational committee for folks to come in and listen to experts, both regionally, statewide, potentially even nationally, about the unprecedented rise in unsheltered homelessness that we're experiencing across the country, and some unique strategies or best practices that places are using to end unsheltered homelessness. So very similar to if you were able to attend our summit in November of last year. This is kind of, the idea of this is for it to be an ongoing space to continue to get that level of education and to continue to talk with experts in the field about unsheltered homelessness. So if you're interested in that, you can sign up, and I might have Liddy put the link in the chat because there's many things on my screen right now. So the next committee is the Services Second Committee. So we had a Housing First Committee last year, and I think that was really helpful for getting education about Housing First and what it is, what it isn't, what are some best practices related to Housing First. But over and over, there was this theme identified that we also need to have the Services Second portion of Housing First really robust for our community to be successful in implementing Housing First. So this is a committee that we're really recommending housing providers and service providers and people with lived experience of homelessness to kind of come and share that space with us and figure out how we can all collaborate better to really have these a robust set of services for people exiting homelessness into housing. So again, the first one is more just like open to all stakeholders and members of the public, anyone who's interested in this topic. This one is a little bit more focused. So if you are a service provider of any kind, we really want to welcome you to that space to figure out how we can work collaboratively to have robust services available to people exiting homelessness into housing. Cool. The next committee is the ESHI committee. So this was a work group we had last year. If you're not familiar with ESHI, it's the Empire State, oh my goodness, Supportive Housing Initiative, which helps to fund a specific kind of supportive housing that we have in our community, and that we are having more and more units integrated into our community. And so this is really going to be a committee of those providers that are working directly with those units, with that funding source, to kind of work together and problem solve on how to improve tenant experiences and to improve service delivery to folks who are in those units. So this one, if you are one of those folks, then hopefully you'll sign up for this committee. We are recommending that people only sign up for one committee at a time this year. You're free to like audit a committee and join and see if it's a good fit for you and kind of pick and choose, but we do ultimately want like one committee per person so that folks don't get too overwhelmed. Next is a system evaluation committee. So this is a committee that's going to be responsible for monitoring the performance of the homeless response system. We really are recommending this for city and county administrators, planners, and staff to work with us, myself and Liddy as COC staff, on kind of monitoring performance of the homeless response system, and we want to make sure that folks who are in this group have an investment in doing this work on an ongoing basis so that we can build the level of education and knowledge that's needed to do that ongoing system monitoring. So that's that one. I'm super excited about that one because I'm a nerd, but I realize not many people would be. So that's all of our committees for this year. So again, we have recommended folks to join each of those committees, but you are free to sign up for them. You can send us an email if they're one of the ones that aren't included on that sign up form that I just sent out. But I'm going to move on to the work groups. So like I said, the work groups are a little bit more time limited and project focused. So these are going to be short term and are going to be pretty specific to their issue and not really branch out in discussion to other topics or related things. So the first is the Housing Surge Work Group, which has actually already started to meet. We are supporting the move-in process for 40 folks who are going to be exiting chronic homelessness into permanent supportive housing. And so we are getting together all of the stakeholders involved in that process to work together collaboratively on a weekly basis and support those exits into that housing. So I will be reaching out to some additional stakeholders who should be involved in that process. But really, we do want to keep this group relatively closed just to protect the confidentiality and privacy of the identities of those folks who are moving into those units. But we do want all of the stakeholders who will be involved at some point to work collaboratively and kind of eliminate some of the common barriers that come up for folks when they're exiting chronic homelessness. Next is the coordinated entry work group. So this work group is going to review the coordinated entry intake and referral process and just kind of make sure that the coordinated entry process is working as we want it to. So it's just an opportunity for me as the coordinated entry lead to get some feedback and to adjust that process moving forward. Next is the rank and review work group. So this is for our annual funding competition. The Continuum of Care is a funder. So we do have a funding competition each year, and this work group will be responsible for kind of looking at the applications we're getting this year and ranking and reviewing those applications for our funding allotment. And then finally is the SOAR work group. So if you're not familiar with SOAR, SOAR is kind of a fast track for access to Social Security income and Social Security disability income, SSI and SSDI, for people who are experiencing homelessness who might be eligible for those programs. We don't currently have anyone in Tompkins County who is submitting applications through SOAR. So we really want to do some outreach to direct service providers who might be interested in engaging in the online learning process. It's free. but it is a hefty workload. It's about 20 hours of self-directed work to do online. So we are trying to get together a cohort of folks to kind of support each other and do that work together and kind of review a lot of the content moving forward so that we can have more folks engaging in SOAR in the future. And that's about it. So thanks. I'm going to stop share. And I know there's been chats and I know I've received some messages. But what I'll say is that on that form, you're going to see signups for the groups that are open. So that are open for anyone to join, like the services second group and the unsheltered homelessness committee, as well as a couple of the work groups. Some of the others are going to be more invite only because of their very specific topics, like the ESHI committee, right? So if you are interested in joining one of those groups that isn't listed on the form, then please just send me and Lydia an email and we can talk about how that would work. But that's all I got for you today. Sorry if I went a little fast. I get excited about committees. Have a lot of information for you. Cool.
Thank you, Simone. All right. I believe we have reached the end of our agenda for today, with even a bonus item. I will follow up with folks with whom I promised to follow up. If people want to follow up with me about anything at all, my name is Lee Barger. I use she, her pronouns. I'm the Director of Housing Initiatives at Human Services Coalition. I realized I never announced myself. And I am putting my email in the chat. Real talk, email is probably the best way to reach me for the next couple of days, especially if you have many words to say, but I will read them and I will try to make a plan for any follow-up that needs to happen. Thank you all for being here. Thank you all for caring about the topic of homelessness and affordable housing in Tompkins County, and like go out there and do good work. Thank you. And